out there. It's really amazing. We're going to hear from Dr. Jenise Wong. Dr. Wong is an assistant professor of pediatrics right here at UCSF School of Medicine and a pediatric endocrinologist at the Madison Clinic for Pediatric Diabetes at UCSF. That is where she sees children with both type 1 and type 2 diabetes, as well as patients with other various endocrine disorders. She earned her PhD from Harvard University in molecular genetics before receiving her MD from Stanford University School of Medicine. Dr. Wong's research interest is understanding how people with type 1 diabetes use their diabetic devices and data, and on how the new technology can be used to help reduce the burden of diabetes and also to improve outcomes. So this is Dr. Jenise Wong.
Thank you, Eva, and thank you to Tamar and everyone at CarBM for inviting me to talk about diabetes and data today and devices. So you've just heard from Dr. Buckingham and heard about all of the great things and wonderful things that are happening in the closed loop world. And what I'm going to talk about now is kind of what we have right now and the devices that you're using now before that April 2017 or whenever it is that you can go out to the closed loop. So one of the things that probably all of you know about type 1 is that it's largely a self-managed condition. And what I mean when I say that is that if you have diabetes, if you're the parent of a child with diabetes, you are making decisions every moment of the day, as Eva talked about in her introduction, without the direct assistance of your diabetes team and your diabetes health provider. You're doing that every single moment of the day. And in order to do that, you use a lot of information. And what kind of information am I talking about? Well, talking about blood glucose data, BG data from your meters. I'm talking about using the fact that you gave insulin 3 hours ago, maybe you're going to give insulin now because you're going to have a snack. I'm talking about what those snacks were. If your child had breakfast 3 hours ago, if they're about to have carbs, you're taking that into account. You're also thinking about how activity, if your child is about to go to PE, if your child has had a little bit of a cold, you're taking that into account when thinking about your blood sugar or your child's blood sugar. And you're integrating all of that in all of the decisions that you're making every day. So the technology is out there, and the technology and the devices may help you, and they can help you kind of keep track of all of this information. Now, what devices are we talking about? Well, Dr. Buckingham talked about a lot of them. First are your BG meters. Your BG meters measure your glucose in a drop of blood. They're your insulin pumps, and as you are well aware, your pumps give you insulin for your carbs based on those pre-programmed insulin to carb ratios that you talk about in clinic, as well as give you basal insulin as well. And then your CGM devices. So for those of you who are on CGM or your kids are on CGM, continuous glucose monitoring, that can help you by getting your glucose levels in your sub-Q tissue every few moments of the day, giving you an idea about your blood glucose patterns. Now, all of the information that these devices collect, your PG data, you put in your carbs, you give your insulin doses, all of that is helpful in two different ways that I want to highlight. So first, there's the real-time ways. There's the ways you're using it every single day and almost every single minute. So for example, with your meter, you check out your BG, it's 250 and you're deciding insulin. That's a real-time use. Or your pump, you're going at snack time, there's a bagel out there and you're going to put in your carbs in there and then you're going to give a bolus. That's a real-time use of your pump. And then finally, if your CGM is showing you 2 arrows are going down, you're going to give your child a snack to prevent a low. So real-time uses, how you use them every day. In addition, all of these devices, all of the data that's collected can be used what I call, and what we out in the field call retrospectively. And what do I mean by that? So the data from these meters, as I mentioned, the meters and the pumps and the sensors can all be collected and uploaded to your computer, your desktop or your laptop computer. And the software from each of these devices can be used to view that data and to review that data. And you are all probably aware of what these look like. They're graphs, they're numbers, they're charts. And you can use that information to look for patterns and make decisions about insulin regimen, calories, activity, that type of thing. Now, your diabetes can do that, your diabetes team can do that, and as you know, you've seen them do it in clinic, and you, as parents and people with diabetes, can do it on your own at home. Now, you can do it together, you can be in contact with the diabetes team, do it over the phone, or you can do it by yourself. But it can be really confusing. How are you going to take all the information together and make a decision? Now, what's important to realize, so those of you who are older, as I think Dr. Buckingham said, more mature with diabetes, you may be aware that a lot of providers, especially adult endocrinologists, actually expect people with diabetes to do that by yourself. You do it at home and then you talk to me. So as parents out there, it's important to realize that at some point your child is going to probably have that expectation put on them by their diabetes provider when they're adults. So what I wanted to know and is out there in the real world and also in studies, how often are people with diabetes actually downloading the data from their devices? That's what I'm going to talk about a little today. So there are a couple of studies out there. There's not much out there in the medical literature. Probably from anecdotal evidence, if I asked you to raise your hand, you can get an answer there. But this is at least what the medical literature shows us. So here's one study. This is a study that was done in 2008 by a group at the University of New Mexico. And they took a group of 94 kids who were using pumps. They divided them into two groups. With one of the group, they taught them how to use Carelink. And for those of you who know what Carelink is a software that Medtronic provides users to use to look at the data from their pumps as well as their CGM devices. In this particular study, they were only using pumps. So this one group was taught how to use Carelink. They were given instructions, and then they were asked to upload their data weekly to monthly. If they didn't do that, then someone from the research team called them and told them, upload your data. And so they got prompts, and they were compared to a group who didn't have access to Carelink at all. And there's a bunch of different results. I'm just going to highlight a couple of them. What they did find was that the Carelink users here had improvement in their hemoglobin A1C. So what you can see here is at the beginning of the study, the average A1C for that group was 8. And then at the end of the study, I believe it was on average a 2-year study, it was 7.7. So improvement, mild improvement, but certainly it was an improvement in A1C if they were using Carelink, especially if you compare to the no access group or the non-user group that you see listed above there. Now, one of the interesting things about this table that I want to point out is this. So remember I said they were asked to upload their data to Carelink once a week, which is 4 times a month, and on average over the course of the study was 2.2. Not bad, but this was with the weekly reminders to upload your data, and on average it was 2.2 times a month. So another Carelink study, so this was done or published in 2014 by a group at Tel Aviv University in Israel. And they did something similar. They had a group of 70 pump users. So this time they looked at kids all the way through adults, age 35. And they also divided their pump users into 2 groups. One, similarly, they taught them how to use Carelink, asked them to upload frequently, and they followed them for 4 months with those weekly, monthly reminders. And then for 4 months, they allowed them to use Carelink, but then they stopped with the reminder phone calls. And that whole group was compared to another group that actually got the reverse. First they were left on their own, and then they got Carelink. So have the different comparison there. Now, one thing I want to point out before I go to the next slide is one of the definitions this group had was who was, quote, compliant, and those are their words, and non-compliant with the intervention. I'm going to check that their words because it's going to show up on the next slide. So what they expected was that the people in their study who uploaded their data 3 times over 4 months were compliant. So that's less than once a month. And if you did this less than 3 times in 4 months, you're considered, quote, non-compliant with the Carelink intervention. So just want to highlight a couple of things that they found. So first, amongst those who are compliant, so you did this at least 3 times in 4 months, so a little less than once a month. Again, over the course of that 4-month period where you're getting reminders, the A1C on average went from 8.5 to 8.17 in 4 months. So again, modest improvement, but it's still an improvement, especially if you compare to the non-compliant, those who did not do this. where your A1C went up a little bit. Again, though, I want to highlight some of the other numbers that are in this table. So at the beginning of the study, you have a certain number of participants who are compliant, but then by the time you stop the reminders, that number goes down from 20 to 7. So this is in the context of a study. You're enrolled in a controlled trial, you get all these reminders. What's happening in real life? What are people with T1D and parents of kids with T1D doing in real life? So we got a little bit of data on this, on CGM use with a study that we did with the T&D exchange, and both Dr. Gilliam and Dr. Buckingham indicated with the T&D exchanges, you all may be participants in the T&D exchange, but again, it's a clinic registry in this particular study, we had over 26,000 people enrolled. There are now, I think, over 27,000 people enrolled, and over 70 diabetes clinics all across the country who are enrolling participants. In this particular study, we had a group of those, 17,000, a little over 17,000, who answered a survey on their CGM use at baseline when they entered the study, and then 1 year later. And again, one of the questions we were interested in looking at in this particular study is how often people using CGM download their data. And here's the table from that particular study. So shown are broken up by age groups, parents of children, parents of adolescents, young adults and adults. And as you can see, the percentage of those who never download their CGM data is what you should hear, it's 24 to 45%. And as is not surprising, based on the data that we've already seen about adolescents and young adults and what happens during that age period, that number is the highest in the young adult period. Now, at the last column that you see there is the people who do this weekly. Every week, they're uploading their CGM data to their computer, and the numbers are less than 12%. And again, higher for parents with kids, lower for young adults and adult people with type 1. So this is some of the data that's out there. This is all download activity. So all of the Carelink, the 2 Carelink studies I mentioned, and the study here that we published with the T&D exchange all just asked, do you download the data to your computer? And left it at that. So what we don't know is, do you download the data to your computer and then call up your diabetes team and say, hey, I downloaded, can you review for me? Or download, bring it into clinic. We don't know that in these particular studies. And so what we wanted to do in our study was get a little bit better idea of that. If you're actually downloading, how often are you reviewing the data on your own at home? So that was our first research question. And then secondly, we wanted to get a little bit of a sense of, okay, what are the characteristics of those who do routinely review their data? What's different about them? And that's what this particular study was trying to do. So what we did here at UCSF, both in our the medicine clinic for pediatric diabetes, as well as our adult diabetes center here, did a cross-sectional survey. Some of you in the audience may have even participated in our study if you came into clinic. We had over 300 people participate, adults as well as parents of kids with type 1. And these are the definitions that we use, slightly different than the ones that those Carelink studies had used. So what we defined as someone who routinely downloaded their data was a child or a parent of a child or an adult who downloaded once between every clinic visit. So typical clinic visits are once every 3 months, right? So about 4 times a year. So if you downloaded once between every visit, that's 4 times a year. So all I wanted to know is, do you download your data 4 times a year or more? So that's more conservative than, once a week or something like that. 4 times a year is a pretty conservative definition of being a routine downloader. And then we also define being a routine reviewer as if you downloaded your data, most of the time that you downloaded it, you actually looked at it instead of download it, getting on the phone, getting on MyChart and saying, hey, I downloaded my data, look at it, if you actually looked at it. So those are definitions that we use. And what did our results show? So essentially, we showed that a minority of people with type 1 routinely download and review their data, at least in the population that we surveyed. So shown on this first slide is the download activity of any device, so meter, pump, CGM, just all lumped together. And as you can see from the orange bars, so the adults are over on the right side, the caregivers of kids are over on the left side. 31% of adults and 56% of caregivers caregivers ever downloaded data from any one of their devices at least once in the last year. So there's a lot of conditions there. But what that tells you is that about 70% of adults, 44% of parents of kids never downloaded data from any of their devices in the year prior to the survey. Now in the green bar, those are those who routinely download, so those are who are doing it once between every visit, and those numbers are 20% of adults, 40% of parents of kids. And then the number that actually review their data, actually look at it, is even less, so 12% of adults and 27% of parents of children. So again, these are all the devices lumped together. What about if we separate by device? So this is adult users only, so anyone over 18. And up at the top left is BG meter data, top right is pump data, and you can see that the numbers who routinely do this at least 4 times a year, 12%, 16%, those who review frequently, even less, 5 and 7%. Now what's interesting about our adult users is the CGM data, which is shown on the lower left, and that seems to be a little bit more frequently downloaded and reviewed. And there could be a couple of reasons for this. One could be that those adults that we surveyed who actually use CGM, maybe there's something about them, they're more likely to be the type that upload their data and look at it. Or it could be that the CGM data itself, there's something about CGM data, something about the way the data is presented or the software that just makes it more interesting, more useful for our adult participants to look at. And this is the caregiver data. Caregivers are a little bit different. Caregivers in general are uploading their data a little bit more often than adults with type 1. And what you can see from this is that pump data seems to be most used by our adults, or by our parents of kids. So 61% are ever doing this, 43% are doing it routinely, and 27% are reviewing that data on their own. So we then wanted to look at those who routinely review their data, both the adults and the parents, and figure out what are the characteristics. And 2 characteristics, which are somewhat related, stood out. One is age, and 2 is the length of time that either the person with the length of time the person with diabetes had diabetes. So the interesting thing was that the relationship was different amongst adults and kids. So if you look at just the adults, if you look at those who routinely review their data, on average they were older. And this goes along with what you already know, what you've heard, that as kids turn into young adults and young adults age, the self-care improves. And so this is in agreement with that. People who have had diabetes for a longer period of time also, as they have lived with it longer, maybe they start engaging with their data more. The relationship is opposite though in caregivers, and this also is in agreement with the data that we see. Younger kids, more recently diagnosed, parents are interacting with their data more, reviewing it, and then as the child goes into adolescence, that parental involvement backs off. And so what you have here is another illustration of the transition problem, another illustration of that T1D exchange graph that you've already seen twice, that there's a transition issue between going from a child to an adolescent, to a young adult, and trying to tackle that window that seems to have some kind of transition difference in diabetes management. So we actually asked our participant to give us some of the reasons why they didn't review their diabetes data on their own home. And these are their answers. So one, it could be that they perceived that their diabetes team did not ask them to do it, or it wasn't necessary, so the doctor didn't ask. It could be that they just didn't know how to do it, or they didn't have the right equipment, they didn't have the right software. It could be lack of motivation, again, their own words. I didn't have the focus. One participant wrote one word, which was lazy. There could be technical issues, they had trouble downloading, or it could be lack of interest or lack of really being able to work with the software that was available to them. So the bottom line from our study, at least, was people with T1D do not regularly review their data. But the more important part of that bottom line is that people with diabetes may be lacking the guidance, may be lacking not motivation because they're not motivated, but because they're not getting that from their diabetes team. But it also could be that the data itself is really hard to get and really hard to understand. And you probably know what I mean, especially when I show you a slide like this. So this is the laptop bag that Jeannie Buchanan, our CDE extraordinaire, carries with her when she is going into the hospital and wants to get data from a patient's meter pump or sensor. And as you can see here, there's a bunch of cables. If you can see on the corner, that's her laptop. It's a PC, it's not a Mac. It's a PC that's running Windows 7, and that's important because not all devices work with all kinds of computers and operating systems. Bunch of cables. You can see there's Dexcom cables, there's pump cables, there's meters, and if you're not as organized as Jeannie, and you have more than one device, you can see it can be really confusing to knowing which one of these cables that you're using. And what this means is that, so even, I don't know if Kathleen's in the room, but even the very lovely Kathleen Frazier, normally who's really calm, is so frustrated, she's pulling her hair out because she can't figure out what to do with her data. And, you know, this can be so complicated it just causes you to give up. You know, why should I even deal with this? Why should I bother? It's just confusing. So say Kathleen actually is able to get her data from her devices to her computer. Well, what is it that she sees? So this, as you probably recognize if you've uploaded your data or visited your diabetes team in clinic, is an example of a pump download. So this is Medtronic. This is Medtronic's website. This is Carelink Professional, so some of you may have Carelink Personal. But the graphs, their charts, their numbers, and there's a lot of information there, and it's hard to know where to start and what to do with it. Now, I'm not just picking on Carelink, and I'm not, it's a little bit faint, I'm not just picking on Medtronic. This is Diasend. Diasend is what we use to look at Animas pump data. It also works with Tandem and Omnipod as well as Dexcom. And I'm not just picking on pumps. This is your CGM data shown in Dexcom Studio. There is a newer version of software available for Dexcom. But you have this information, you have pretty colors, and you have numbers, and you have graphs, but how do I know what to do with that? How does that help me decide what to do after a basketball game? Or how does that help me on pizza night? And do you end up like Kathleen and just end up giving up? So, taking all this together, what we do realize and what you all realize is that collecting and reviewing data at its current state isn't enough. Looking at those graphs, looking at those pretty colors, isn't really enough to help you use that data and making it useful in your daily life. And it actually may discourage you because it's so complicated. So what we need are better tools, and we need better education about what to do with the information to actually help you improve your lives and help diabetes self-management. And moving forward, this could be addressed in a few different ways. I'm going to talk about 3 of them. So first, perhaps it could be easier to just get the data. Could we get rid of those cables? Transferring data to devices you use, like your phone, as opposed to your laptop computer. So I'm going to talk a little bit about what's out there in terms of hardware. Second, the software itself could be more user-friendly. So one, maybe something about all of those graphs, numbers, and tables could be made a little bit simpler, a little more user-friendly. Maybe you can incorporate other data from what you're eating, your activity, if you're sleeping, what we call contextual data, and maybe that could help you a little bit better. And finally, maybe your diabetes teams, your providers can work together with you to help you understand the tools that we have, help with the education to know how you can use those patterns to make changes in your lives. So first, talk a little bit about device software and what's available, and actually some of these vendors may actually be outside today. So let's start with meters first. So OneTouch, which are 2 meters over on the left, offers a couple of different options. So on top is the Vario Sync, on the bottom is the Vario Flex, and both are Bluetooth-enabled meters. They store your BGs, and then they wirelessly transmit them to your iPhone. Only works with, I believe it only works with iOS. The Flex may work with Android as well. And once you open the app, all of those BG data are automatically wirelessly transmitted to the app. In the middle, in the center, is the IBG Star meter, which connects directly to your iPhone. Again, Apple only. The iHealth meter, which is in the center. Bottom is another meter that wirelessly transmits BGs to an iOS device only, so your iPhone or your iPod Touch. And then finally, the device on the left is the Livongo Health meter, which wirelessly transmits data to the cloud, so you don't need a phone to use the Livongo meter. and to whomever else that you select as a user. So what all of these meters do is they eliminate the need for those cables. They eliminate the need to sit down at your laptop and hook up to your laptop or your desktop computer. And all have mobile apps, so that's great. Things to consider, though, are the cost of the device, the cost of the strips. Do you have to have a special strip? Do you need a subscription to the service to use the app? And so these are all things to think about when you're actually thinking about using them. Is your insurance going to cover it? Maybe, maybe not. Pumps and pumps data. I can just really briefly talking about what Medtronic now offers in terms of MiniMed Connect. So with MiniMed Connect, you can purchase an uploader from Medtronic, and the uploader allows you to upload your pump and your CGM data either from MiniMed 530G or Paradigm Rebel, and that gets transmitted, again, just to your iOS device, so your iPhone or your iPod Touch every 5 minutes, and you can use an app to view the data, and you can also transmit that data to your friends, family, or providers, who can then look at that data in Carelink Personal. So that's now what Medtronic is offering. And finally, Dexcom offers something similar through its Share program. So the Dexcom G5 with Share, you can transmit the data from your G5 sensor directly to your iOS device, again, your Apple device only, which again gets transmitted to the cloud, and then transmits to at least or up to 5 other friends or family members. It also works with the G4, it's just that it doesn't go through a phone, it goes through the transmitter. So the hardware is, there's progress being made out there in terms of making your data more easily for you to get. Now what about the software? Now you've got it, what are we going to do with it? So I'm going to talk about just 2 different companies and 2 different efforts, both of whom actually have tables here. Oh. I don't know if someone's lying on the light switch or lead up against light switch. But to kind of talk about 2 different companies that have made some effort in terms of, I know we're all sitting still too long, maybe that's what it is. Software platforms for diabetes data. And both of these platforms, what they do is not only do they offer different ways of looking at your data, but they offer ways that you can incorporate data from different devices. So you have a meter and a pump, and maybe you have a Fitbit, but they're both platforms that will integrate all of that into one place. So the first is Gluco. I believe Gluco has a table here today. And what Gluco offers is the meter sync device. And the meter sync device hooks up to your phone. So this Gluco, you can either have an iPhone or it works with Android as well. It works with over 40 different blood glucose meters. It works, I think, with Omnipod, yes, and Dexcom. And so what Gluco, the device, is able to do is incorporate all of that data. They have an app on their iPhone. They have an iPhone app for you to use, and you can just get that from all of your devices in one place. Personal subscription, I believe, is about $70 a year. The other company that I want to highlight and talk about is one that Dr. Gitteman already alluded to, and that's Tidepool. And I don't know if they are in the room. There's Brandon in the back, and Sarah, and Howard is probably outside. But Tidepool is a nonprofit organization. It had its origins back, I was looking back, I think it's 2012, when I started collaborating with Dr. Adi, who's right in the middle of the auditorium, as well as Erin Meinstein, who's an adult endocrinologist, with families and families with kids with T1D, as well as people with T1D. So Brandon and Sarah are 2 examples in the back, and some of you out in the audience may be familiar as well. But we started this collaboration to really allow you as families and people with diabetes have access to your data, and to freely have access to your own data. So the result is this nonprofit collaboration company called Tidepool that's now headed by Howard Look, who I guess is outside, President and CEO of Tidepool. So what Tidepool offers is an open source platform, secure platform for your diabetes data. And Tidepool then allows other companies to build applications on top of that data to use it. Typeful itself has built a couple of applications. One is the Typeful Uploader, so that's the program that allows all of these devices to upload their data to one place. And the second is Blip. Again, Dr. Gittleman mentioned Blip, which is a visualization application allowing you to look at all of your data in one place. And thirdly, they offered the Blip Notes application that allows you to put contextual data. So you can actually put in the context of your diabetes data, oh, I had a bagel this morning, or I felt sick today, or I went for a run. So it allows you to view that data in the context of your diabetes data. So we at UCSF have actually conducted a study of some of our patients with Blip, and some of you in the audience may have even participated in that particular study, and I'm going to talk about that at the ADA in a few months. In addition to that, we at UCSF, Stanford, Barbara Davis Diabetes Center in Denver are working with Blip to actually integrate this into clinic use, and so that's coming, that you will actually see Blip, you will see us use Blip in clinic very soon, in the next few months. So that is software. But as we wait for some of this new technology to develop, and as we wait for it to become more widespread, what we also feel is important is to help everyone better understand and make the most of the data that they have. And the way to do that is to understand what you are doing with the data right now. And that's research that I'm doing currently. So what we need is to understand your frustrations with the data, but we also want to understand your successes with the data, how you're actually able to use it. And so what I am doing is using that information to improve the way that we educate families on their patterns. How do you use that pattern and know what to do at a basketball tournament? How do you use your diabetes data and know how to act differently on pizza night? In particular, I'm conducting focus groups. I'm looking for families who have kids 11 to 14 years old. So if that applies to you and you would like to participate in this effort, please let me know, and please contact me because we're actively looking for families of pump users and CGM users, 11 to 14 years old. Now, in the meantime, that's great and that's coming, but what can I do now? What can I do when I go home this afternoon to help me make better use of my data? So the first, well, download and review. Now, maybe that's easier said than done. Maybe you've done it before, but if you've never done it before, maybe think about trying it. Assuming you have the right software, and assuming you have the right computer and the right iOS, but get in touch with your diabetes team, get in touch with your device reps, and just explore it a little bit. Second, try Blip. Visit the Typeful booth outside. Go to blip.typeful.org using a Google Chrome browser, and just check it out. Talk to them today and see what you think about a new way to look at your device data together and a new way to view your data all together at the same time. Third, talk about patterns as a family. What do I mean? So I'm talking about even before you connect that cable to your device to the computer, even before you try to look at your data, just start to think about patterns and where you might find patterns. And depending on the age of your child, involve your child in that as well, if they're old enough to have that conversation. So, for example, what happens to BG on soccer practice days? What happens the morning after pizza night? Just think about it. And if you start to think about it and think about where you might find patterns, where you might suspect patterns, that makes tackling that download better instead of just looking at it and saying, oh, let me find something. If you have a particular question that you're interested in, that helps. The other thing to keep in mind is no changes in the instant can be made in one moment in time. You need to look at a couple of days. So think about something that happens every day, or maybe happens on the weekend, or happens Monday, Wednesday, Friday, and take that as your starting point for looking at your data. And finally, your BG numbers, we acknowledge, are more than just numbers. They actually can be a source of a lot of emotion. So they can be a source of stress, anger, and arguments between you and your child, but they actually also can be really a source of triumph. I've seen all of you, if there's a BG and you are 100 when you wake up, you're really happy and you're really celebrating that. And I just want to acknowledge that, and I think that everyone should just have the space to acknowledge that and be mindful of it. Reflect on it, think about how it affects your own emotions, think about how it affects your child, and how that might affect their desire to check their BG. There's so much emotion tied into it, it may affect the ability to check their BG, let alone look at the data. So I just encourage you to be released from any judgment about those numbers and just use them as an opportunity to make a change and then move forward. Ultimately, if you consider some of these things or consider some of the new technology that's out there, the goal is to make all of that diabetes data more meaningful, more actionable, leading to ways that you can actually lead to healthier lives, improved A1C, all of these great things for you as families with type 1. So, just in closing, I want to acknowledge just a lot of people, you for listening to me right before the break. I want to thank my colleagues at UCSF, all of our participants in the studies, some of you are out there, as well as our patients at the Madison Clinic, and we welcome UCSF. Thank you.